Dr. Sunil Dachepalli. I'm a senior orthopedic joint replacement and sports medicine specialist at Yashoda Hospital, Somajuda. I'm here today to inform you about the World Arthritis Day that comes on 12th of every October. The whole idea of this day is to make people aware about arthritis and how to overcome it. Now, nobody can avoid it because we're all human beings. The more we use the joints, the more wear and the more arthritis. There are two simple types of arthritis. One is called inflammatory, which usually is called rheumatoid arthritis. The other one is called degenerative, which is wear and tear. Rheumatoid arthritis comes very early in life, so you need to take regular tablets and be in touch with either an orthopedic or a rheumatologist. Whereas degenerative, it's more of wear and tear. This is where it makes a lot of difference. The degenerative arthritis can be postponed. Now we see a lot of younger population coming around with early arthritis or sometimes severe arthritis in a very younger age group. This is where we have to be very careful. If you can act faster, simple proverb is a stitch in time saves 9. So if you act fast and if you're careful about your joints, then you can postpone your arthritis. Now a lot of people ask me, can I avoid arthritis? Nobody can avoid arthritis, but you can push it to very later in life. I have seen a lot of people in my practice that they jog at the age of 70, 75 as well. And there are a lot of people who didn't have a knee replacement in their lifetime. So if you take for example, my father as well. Now, the thing is, you need to be wise. So what to do? First and foremost is physical activity. There's a common misnomer that if you get arthritis, you should not walk, which is totally untrue. The more you walk, the more physical activity you give to that joint, the muscles are strengthened, which take over the load from the joint itself, and then the amount of wear is less. So always, if you have arthritis anywhere in your lower limbs, you can walk, provided that your body supports it. So do as much as walking as your body allows, and then strengthening exercise around the joint. In India, we see mainly knee arthritis, whereas if you go abroad, you see hip and knee together. Now my suggestion is always think of knee exercises, hip exercise, and also your spine exercises. If you do these three exercises and do regular walking, you should be very fine. Now, you have done all these things. In spite of that, you have come to early arthritis. Let us see what is this arthritis. So we all see this is a knee joint. You can see the cartilage. This is a normal cartilage wherein the covering is very smooth. Whereas if you see this one, this is early arthritis. You can see patchy loss of cartilage. If you see this, complete loss of cartilage. If you come to this stage where we call it advanced stage or grade stage 4, you end up having a knee replacement. This is called a total knee replacement. So we want to avoid this at any cost or postpone it. So what I suggest is act at the early stage. So what do you need to do? Like I said, we can all plan for early physical activity, and you can also take some tablets. Now these tablets are collagen or glucosamine tablets which help in the cartilage formation. Try to avoid painkillers as much as possible. The simplest you can take is paracetamol. If only the pain is severe, go for things like aceclofenac and diclofenac. The next thing is injections. Earlier days we heard of lots of steroid injections. And this is mainly to give you pain relief for some period of time so that you can postpone your surgery, or if in unavoidable circumstances where you can't have surgery, to give you relief for some months. So these are called steroid injections, and we do only in these circumstances. The good thing is we have some latest injections nowadays which are called platelet-rich plasma and stem cell. Platelet-rich plasma is the blood we take out from the same patient, concentrate the cells and give it back into the joint. Whereas if you go to the stem cell, which is otherwise called bone marrow aspirate concentrate, we take out from your iliac crest, from the hip bone, or we can take out from the shin bone. We take it out again, concentrate, give it back. And in some scenarios, we also take it out, culture, increase the number of cells, and then inject back into the joint. The next stage is called cartilage transfer. In younger patients who have some areas of cartilage loss, they can't have joint replacements. The reason being they're too young. So we want to replace just the lost cartilage. So we take out cartilage from other areas and then replace it back. These are called AC and MACI. Now the next step, in spite of all these things, you are in your middle age or later age, but you have only some areas of cartilage loss. We can do nowadays called partial joint replacement. So you don't need to have a complete joint replacement. The beauty is you have smaller cuts and then your mobility is quicker, you're out of the hospital quicker, and you're back to your functions very quick. The last one is a total joint replacement. The indication for this is mainly pain. We get a lot of patients saying, when should I have a joint replacement? Only when you think your life is not worth living because of the pain and your everyday activities are curtailed. You should go for a total joint replacement. The beauty about this is you almost will see a second life. We usually make the people walk in 4 hours after surgery, and by the time they are discharged from the hospital in about 3 days' time, they'll be walking, they'll be climbing stairs and doing most of their activities. And almost at the end of 2 or 3 months, they almost feel like a normal joint. And there are lots of varieties in these joint replacements also. It's mainly to do with the material. We have ceramic, we have the other metals, which is an alloy. So, and also we can ask your surgeon to do what is called a high flex knee, wherein in Indian scenarios, we want to sometimes squat on the floor. So these high flex knees will also have the advantage of complete bending. The one more advancement in these joint replacements is the robotic technology. We use this technology, robotic, or also called navigation. These technologies are used to be giving more precise surgeries. So we have this wide array, but what I suggest is, like earlier I said, the stitching time saves 9. You want to start off early, act early. You can also have this PRP stem cell injections very early in arthritis so that you can avoid surgery. So my suggestion today is to act soon to avoid major problems at a later date. Have a good day.